educational session of the day. We are excited to hear from Jake Heineke, the Emergency Medical Services Education Coordinator and Hospital Emergency Coordinator at the Central Montana Medical Center, along with 3 of our Lewistown local EMTs. Together they're going to be teaching us what to do while waiting for an ambulance to arrive, and an important and practical topic that can make a real difference in our rural communities. The Central Montana Medical Center EMS education team is a group of emergency medical technicians, paramedics, and nurses who have a vast array of work experience in the field of emergency medicine, but even more so, a greater background in livestock and agriculture. Michelle Crawford is a nurse and paramedic at Central Montana Medical Center. Michelle was raised on her family's ranch near Lewistown. Michelle brings to the table an immense knowledge of trauma medicine and real-world experience and a passion for teaching others. Michelle started her EMS career in 1992 and ultimately worked as a flight paramedic for 12 years in Georgia before returning home to her family ranch near Lewistown, where she also continues to work as a paramedic and emergency room nurse. Erin Slivka is an emergency medical technician from Winifred who, in addition to being a lifelong agricultural producer in Central Montana, is also a high school teacher for a number of years. Erin's knowledge of rural medicine is invaluable to our team, but where Erin really shines is our curriculum development. The far out and waiting presentation that you see here today is her brainchild, and here highlights her ability to bring a curriculum to life. Janae Butcher is a paramedic and has been with Central Montana Medical Center for the past 6 years. Janae was also raised on her family's ranch here in Central Montana. A career in rural emergency medicine has made teaching the real-world concepts of the Far Out Waiting program second nature for Janae. A lifelong learner herself brings to the forefront current education trends and practices that are necessary for the team to progress. Jake Heineke is an emergency medical technician for Central Montana Medical Center. His official title is EMS Education Coordinator, but in reality, that title belongs to the team he is graced to work with. Jake has been in EMS since 1993. He has worked for a deputy sheriff for Beaverhead County for 18 years before moving to Lewistown, where he continued to work as a deputy sheriff for another 5 years at Fergus County Sheriff's Office. Jake retired from law enforcement in 2017 and now works full-time for the Central Montana Medical Center, where his main role in EMS education. So, Montana Farmers Union has been doing these far-out waitings across the state. Our ambassador team has been putting these on everywhere in their communities, so we decided to bring a mini crash course, no pun intended, to our annual convention. So, we'll get started.
Thanks, Mary, and thank you for inviting us to be here. Huge shout out to Mary Jenny. This program has been really well received in the rural areas. We did one of the first presentations out in Winifred, and we had, I think, about 25, 30 people at that one, and I'm continually asked when we're doing it again, because people really picked up some invaluable information. So when we first started talking about what kinds of topics to present at a far out waiting type workshop, we were just thinking in terms of where everybody is in relation to where the ambulance is and where the EMTs are. For example, I live about 15 minutes from Winifred, 12 if it's a really tough emergency. And so it takes me that long just to get to the ambulance. And then some of our calls can be even 45 minutes to an hour away from the ambulance. So that could be a really long time period for people to be waiting. So just curious, raise your hand if you live 10 minutes or more from your local ambulance. Yeah, so about half. And I'd say the further into eastern Montana you get, the more hands would probably be raised just because of our vast distances. And so there are some things that people can learn, even if you don't want to be an EMT or a first responder. You can learn some skills that can really make the difference between survival or or a death situation just by picking up a few tips. And you can also make our job easier. So we're just going to kind of fly through some of these quick concepts, and then afterwards do a little hands-on training for people. If you're interested, we'd love to work with you one-on-one. I drew the short straw tonight and get to be up here talking mostly, but I am going to throw it to our team for questions. So if you have a question at any time, please don't be shy. We'd love to answer any questions as we go through. So let's see if I can work this. Pass that. So like I said, we focused on what to do while you're waiting. As soon as you identify that there's an emergency situation, of course, we all know, dial 911, right? But what happens if it takes 40 minutes for the personnel to get there? So we kind of decided these are the big things that the most calls that we might get, or the things that we have tips for you that you could help treat. Also, kind of just to talk about some myths or maybe old wives' tales about some of these issues that we want to dispel so that you're not doing the wrong thing while you're waiting. So some of the things we'll talk about are diabetic emergencies. I'm not sure we're going to go into all of these tonight because we have a long day today, but this is a pretty quick list of what we might see in a rural area for emergency situations. So first of all, should you call 911? I often joke, I work in the Lewistown service and I also volunteer in Winifred. And when we get a call in Winifred, everyone in the Lewistown crew goes, oh crap. Because Winifred people don't call 911 unless somebody's actually dying. Here in Lewistown, we might get a call to go pick somebody up off the floor or out of a bathtub or whatever. But out in Winifred, those people are independent and they're not used to asking for help. So usually in a rural area, if you get a 911 call, it's pretty serious. So why would I wait for the ambulance when I could just go to the ER on my own? So there's some things that we'd like to emphasize. First of all, safe transport. A lot of times if it's just you and somebody that you love, you're not really in an emotional state to be driving. So we want to make sure that the trip to town is safe. We also have some medications that we can deliver that can really make a difference in the outcome of the emergency. And we have resources that we can call. If we don't have a paramedic like Janae out in Winifred, I can call Lewistown, they can intersect with me, and she can deliver more medications. So we have those resources. We can provide trauma care. We have a lot of tools on board to do that. We can also recognize if we need flight, and we can make those arrangements with our dispatchers who can get flight in from a number of different areas in the state. We have great flight resources in Montana, but people may not know how to access them. So if you call 911, they get those wheels turning for you. We can provide cardiac arrest care. We have equipment that monitors our patients and their vitals on the way to town. We have direct communication with an ER physician all the way to town, and immediate access to the ER. So once you get to the ER in a private vehicle, you have to go through triage, whereas we take you in the back way and can get you right in. And over here is just a little anecdote. We really would rather see everybody healthy at the ball game than have to see you in the back of our ambulance. So we really concentrate on proactive health. And a lot of our education programs are proactive, teaching people how to recognize things before they become an emergency as well. So what do I do while I'm waiting? First of all, when you call 911, give as much information to dispatch as you can and update if anything changes. Like I said, it takes me 12 to 15 minutes to get to town. Something may have changed by the time I get to town, and I don't have cell service. So if you're on the phone with dispatch and you're updating them, they can give us that information over the radio as we progress to the call. Also, if your loved one has a POLST or a DNR order, get that out for us. We'd love to take that with us so that we know exactly what kind of care this patient wants in the event of the different types of situations that we'd have to make those decisions. Yeah, go ahead.
Ask what is pulse.
Oh yeah, absolutely. So in Montana, we recognize a pulsed order, and this is just a physician's order that is divided into 3 components, and basically your physician will sit down with you and go through that checklist, and you can decide what level of care you want in the event of, for example, if you're unresponsive or if you are in a coma, what kinds of care would you like? If you do go into cardiac arrest, do you want resuscitated? Do you want to use an AED and chest compressions, or do you just want comfort care? Do you just want painkillers?
So it's like an advanced directive.
Exactly, it's an advanced directive. So if you don't have one, I strongly consider at your next wellness exam to ask your physician to develop one of those. A lot of times they're on a green colored sheet, and if you hang that up on your fridge, we know to look there when we come in, and that gives us specific directives for your care, and it eliminates the need for your loved ones to have to make those decisions for you in a time that can be really emotionally distressing. So another thing you can do is make a copy of the current medication list and even gather those medications in a Ziploc bag. We'd love to transport that with us to the ER. Write down any pertinent medical history. We don't need to know if you had your tonsils out when you were 10, but if it relates to what's happening today, we would love to know the history. And then really important is, when was the last known normal? And this is especially important in the event of a stroke. And this is a story I was telling Mary earlier. We had a call where a gentleman had a stroke, and when we came into the house, his wife had been at the Far Out and Waiting workshop, and she said, I was trying to remember all of the things that you told us, and one of the things was to know when he was last normal, so I wrote that down for you. That's huge for us, if you can give us that kind of information. And then write down any medications that the patient may have taken recently. So when you're on the phone with dispatch, make sure you're giving good directions if your house is difficult to find. And it says, remember, if UPS can't find you, we can't either. A lot of us live out in the boonies, right? It might not be that easy to find where you're at. So turn on some lights. Maybe have a flagger at the end of your driveway to flag down the ambulance. Out in the Breaks area where I live, I mean, I've been there for 30 years and I still don't know where everyone lives. You all are really good at hiding out in rural Montana. So give us some big signs of where we can find you. So what do I do while I'm waiting? First of all, make sure we can back in and access your doors. Again, a lot of us in rural Montana have a lot going on in our yard, right? We might have goats and chickens and dogs and 3 broken down old Fords or Chevys, whichever you want to pick on tonight. So try to clear us a path so that we can back in and make sure that all those goats and chickens and maybe your mean guard dog are locked up and secure so that we're not threatened when we get out. Tell Grandpa to put the shotgun away, that we're actually there for a reason. We want to make sure that's safe for us to go in. Make plans for a friend or family member to drive to the hospital. So maybe your significant other is going in the ambulance, but you're going to need somebody to drive in behind the ambulance, and you might not be emotionally okay to do that. So you can call a friend to come and sit and wait with you while the ambulance is coming. And then provide basic treatments for specific conditions that we'll talk about here in a minute. Also, you can help your person gather what they might need: a cell phone, medications, a charger, change of clothes, that kind of thing. So when should you not wait? This is a really important question because it feels like in that moment you really just want to go. And sometimes that is beneficial to just go. So if you can safely move the patient to a vehicle without causing them more a long way from medical care, and time is important. And if the patient has bleeding, chest pain, or symptoms of stroke. Those are the situations where we might encourage you to go ahead and start for town, especially if you're an hour or more away. What do you do if you decide to drive towards the ambulance? So you're going to tell 911, I'm heading out, this is when I'm leaving, I'm taking this route, because out here we might not have cell service, so once you leave the house you might be without communication. So make sure dispatch knows what you're driving. Go ahead and turn your flashers on so that you're easily identifiable. Make sure that you drive safely, and make sure that you're communicating with dispatch if you can, and you know kind of where you're going to meet the ambulance so you can pull over at a safe spot and make that transfer. All right, so just talking about some of the specific conditions that you might be worried about. One of our most common calls, especially in rural areas, is a heart attack. So how do I recognize a heart attack? There's a couple different categories of chest pain. You have angina, which is just caused by lack of oxygen to the heart. A lot of people suffer from this regularly. A lot of people have nitroglycerin to treat that. Angina usually is better within about 10 minutes with rest and maybe a nitroglycerin tablet. So if your person is feeling that chest tightness or pain, if they rest or take nitro, they might start to feel better. If they don't, then you start to suspect maybe this is a heart attack. So this is when there's actually death to an area of the heart muscle due to lack of oxygen. So signs and symptoms, this can be different for a lot of different individuals, especially male and female. But in some cases, they're going to have chest, arm, or jaw pain. Sometimes it starts kind of in the chest or the arm and kind of radiates up into the jaw. Almost all of our patients say that they feel weak or fatigued, difficulty breathing. Their skin might get really pale and clammy. So I always say people shouldn't be shiny unless they've been recently chased by a bear. So if you just come in from being chased by a bear or a mad cow, it's okay to be sweaty, but otherwise, if you're kind of cool and clammy, that's not a good thing. That means you're probably sick. A lot of our patients will say they have this feeling of something's really, really wrong. Some patients will start to say a prayer. Some will start to talk about calling loved ones. They really feel like something really bad is happening. They might say it feels like there's an elephant sitting on their chest. On the other hand, I've had heart attack patients who just say, yeah, I just don't feel really good. I'm kind of tired, and I kind of feel like I have indigestion. And a lot of women will be like, well, when I got up this morning, I didn't really feel good, so I made eggs and bacon and sausage and pancakes, and then I did all the chores, and then I went out and we moved some cows, and then I came back in and I fed the crew lunch, and I still really didn't feel good, so I had a Tylenol, and that didn't really help. And so I went back out and sorted some calves off, and then I just really felt like I couldn't do much anymore, so I came and sat down. And when I sat down, my husband realized, gosh, there's something really wrong with her. She's sitting down. So he called 911. True story. Somebody actually told me that story, and she flew to Billings with a heart attack. So symptoms can vary really widely with heart attack, but these are some of the more common ones. So how can you help in this case? Call 911. Probably before you go work cows and do all of that. If you're really feeling that poorly and not like yourself, get yourself to the doctor or call for some help. If you suspect it is a heart attack, 4 baby aspirin chewed up. Each one should be 325 milligrams. Or if you don't have chewable, just take one 325 milligram aspirin. Help the person with nitro if they do have nitro prescribed to them, but be a little careful about that. You might, if you have called 911, we might be able to help you with that when we get there, and can take a blood pressure as well. Have the patient lie down and prepare to administer CPR, and consider driving to meet the ambulance. This is one of those situations where if the patient can walk and get in a vehicle, that might be a good idea. So cardiac arrest. So a heart attack is death to a portion of the heart muscle. Cardiac arrest is when that heart just stops beating. How do I recognize it? Well, your patient's going to be unresponsive. You're going to check for a carotid pulse on one side of the neck, and you're going to check for breathing. If you don't feel a pulse and you don't detect any breathing, you're going to call 911 and start hands-only CPR. And I am going to turn this to Jake to tell us how to do hands-only CPR.
Actually, so glad to bring that up. We're going to actually talk about that afterwards. Like Eric said, we're going to have some breakouts if people want to wander out of there. We'll actually show you that over there. But literally, the point of hands-only CPR is bare the person's chest, put two hands in the middle of their sternum, and just start pushing as hard and as fast as you can. That's literally what it takes to hopefully get blood flowing again. One thing that comes up in some of our classes sometimes, what happens if they don't need CPR? You start pushing on somebody's chest, and guess what? They're responsive. Can you guys hear me back? If I talk louder, do I need to talk to the microphone? Is this better? No, I can't yell. So if you push really hard on somebody's chest and they don't need it, what's going to happen? They're going to yell. They're going to say, "Ow, that hurts." So what do? We stop. But if you push really hard, really fast on somebody's chest and they don't do that, keep doing it. Keep doing it until Erin shows up in her flashy ambulance. Keep doing that until the helicopter shows up. Keep doing that till you can't do it anymore. And again, after we're done here, we'll have a short breakout and we'll actually show you that up here.
So the other thing that you can do if you're in a town, maybe try to track down an AED. Make a phone call, have your cell phone on speaker, and maybe try to find an AED. All schools will have an AED now. A lot of times your community center, your post office, somewhere might have an AED. They're really easy to use. You literally open them up, push the button, and it tells you what to do. So it'll tell you where to place those pads, and that could mean the difference between life or death for that person. So the window of time on cardiac arrest is very small. So this is one of the ways where you at home can make a huge difference. And we encourage you to come and practice and get some more hands-on instruction with those AED operation and the hands-only CPR. The reason that hands-only CPR is great, even we used to do the mouth-to-mouth, right? We're telling you now, don't worry about that. Just do the compressions, because as you're compressing the heart, you're also compressing the lungs. And as you let go, what's happening to the lungs? Air is moving in. So that patient is going to be getting air as you're compressing. So don't worry about the breathing. Don't worry about all the rules. Just do those compressions. Try to find an AED and make sure you have 911 called and ready to go. So another one that we worry about, of course, is stroke. How do I recognize it? If you can remember, be fast. That really helps you out. You look for balance. So has the person suddenly lost the ability to maintain their balance? Does it seem like they have a deficiency on one side or the other? Look at their eyes, or ask them, can you see out of both of your eyes? Sometimes they'll lose vision out of one or both. The rest of this is what we use really quickly when we walk in the door. We look at the person's face. Are they drooling? Is there one side of the face that is drooping? If I don't detect that right away, I'll say, smile, show me all your teeth. And if that smile is really lopsided, that indicates they might be suffering from a stroke. Look at their arms, ask them if they have any numbness. You can ask them to hold their arms out with their palms up. And if one of those arms kind of starts to drift down, that's an indication that person might be having a stroke. Is the person's speech slurred, or do they seem confused or unable to speak? That doesn't happen in all strokes, but in some strokes it will happen. That can be a really good indicator. And then the T stands for time. There's two ways to interpret that. One is it's time to call 911. The other is, remember when I said know when they were last normal? So the time that they were last normal, that can really help us. We have a really slim window of time where we can administer a drug that breaks up the clot that is causing that stroke. And so if we can get that patient to that definitive care in that amount of time, we can really have a big impact on the outcome. So this is a situation where you would consider driving to meet the ambulance if you can safely put that person in the vehicle and you're a long ways from an ambulance. So we have about 3 hours, and if you can tell us when that patient was last normal, we can consider maybe getting a flight in if it looks like we can't get to the hospital within that window. So trauma is usually pretty easy to recognize, but not always. Sometimes those scary looking injuries aren't critical. A person can be kind of bloody and banged up and look pretty bad, and it might not be critical. Sometimes our most critical patients, we don't see a drop of blood. Where's all the blood going? Inside. Yeah. So we particularly see this in rural areas with livestock related injuries, with horseback injuries, with ATV accidents. We have those situations where somebody goes up and over the handlebars and they are injuring organs and they're bleeding inside. So in those situations, it can be difficult to recognize what's going on, but there's some things that you can look for. Remember that shiny guy that I was talking about? You don't want to be shiny unless you've been chased by a bear recently. So if the patient looks pale and shiny, like they're sweaty, that's a pretty good indication that there's something serious going on. You need to call 911. Also, we have something called altered mental status. And I know some of us suffer from that, so it seems like every day. But in our world, altered mental status means not normal. This is outside of the baseline. So Jake kind of has a little bit of altered mental status going on from time to time, but I kind of know Jake's baseline, right? So if I know what Jake usually acts like, and this is different, that's what we would call altered. So altered mental status can be a possible injury, head injury, or possibly it could be somebody who is going into shock, and that will cause oxygen to not really be perfusing in the brain, and they start to act confused. Sometimes they have a little bit of personality change and just not acting like themselves at all. So watch for those signs of shock. If they're confused or dizzy, if they have a fast, weak pulse, rapid breathing, or that cold, sweaty skin. Shiny guy, that's never a good day in EMS. So how can you help? Learn how to do some basic splinting. This photo is a SAM splint. You can pick one up at Albertsons or on Amazon. They are not expensive. They're something really easy to have in a first aid kit, and they're formable, so they form to whatever limb you need them. And you just take a little vet wrap or even just pieces of cloth and tie that on, and you've splinted the person. So you want to immobilize that area, protect the skin from injury, and attempt to stop bleeding. If that patient shows those signs of shock, you're going to lie them down and cover them up, and that will really help them maintain their body temperature. So bleeding control, Jake is going to do some hands-on instruction with this, but of course, how do I recognize it? This is pretty easy, right? If it's bleeding that we can control, we're going to see it. So bright red blood usually means an arterial bleed, and we're going to try to stop that as soon as we can. Venous bleeding is usually a little darker red and oozing, but you can still have significant blood loss from that. So Again, we're looking for that pale, cool, clammy skin. We're looking for rapid heart rate, breathing, falling blood pressure, and maybe confusion or unresponsiveness. How do you help? If it's internal, there's not much you can do. Call 911, get the patient to a hospital as quick as we can, cover them up with a blanket, and consider requesting flight or meeting me somewhere. With external bleeding, we're going to do the stop the bleed, which is pressure, and if we can't get it stopped with pressure, we're going to use a tourniquet. So I'd encourage you to come up and do some hands-on practice with that. Everybody in this room should have a tourniquet in their home, in a vehicle that is frequently around things like augers, things that can cause injury. We put one in our service truck during the busy times like harvest. It's just a really easy but could be critical step to keeping your loved ones from dying out in the field. And we've all heard about it. Most of us all of us have seen it. Tourniquets save lives. If you have one piece of equipment that you're going to have in a first aid kit, that's it. And your Band-Aids and your ACE bandages and all of that, they don't mean anything in a lot of life and death situations, but a tourniquet could save somebody's life. So get a tourniquet. So here's your stop the bleed actual steps. We will talk more about that if you want to come up for one-on-one. And cold emergencies, real quick. We're coming up on winter. There's 3 different types of cold emergencies. Frost nip we have all had, right? Numbness or pain that kind of tingles when we warm back up. Probably a lot of you have had frostbite. That's when you get that hard, frozen, waxy skin, and it might blister up and change color. And then hypothermia, when the core temperature is below 95 degrees. You really worry when that patient stops shivering. That's a bad sign. So how can you deal with these? With frost nip, you just warm the person up. That's going to go away pretty quick. Frostbite, you want to remove the person from the cold environment, remove any wet clothing, remove all jewelry, and then bandage the affected areas and immobilize them. Do not ever apply direct heat or massage because that can cause really bad tissue damage. With hypothermia, you want to remove the patient from that cold environment, remove wet clothing, cover with warm blankets, and turn on the heat. Again, do not massage those tissues. We're almost to the end of this. I promised a short session. We're almost to the end, I promise. Falls, a lot of us, unfortunately, have had these, even if you're not old enough to have the elderly fall. I think probably all of us have fallen in a corral or over a gopher hole or something. But a serious fall is usually from a distance greater than the person's height. But any fall that causes dizziness or a loss of consciousness or confusion, pain or loss of mobility, or changes in vision or nausea can be serious. So we had somebody who fell out in our rural area, and they got a pretty good goose egg, but they, rubbed some dirt on it, and it was fine, right? Well, 2 weeks later, we got paged to the bar because that patient had started having seizures. So what can happen if you ignore symptoms like this is it can create a life or death emergency. And that person ended up having a brain bleed that was just slowly bleeding for about 2 weeks and finally started causing enough pressure it was causing seizures. So take these symptoms seriously if you see them in a patient or in yourself. So I think we're there. Any questions before we break this out into hands-on? All right. Feel free to come up and ask questions. We have some really great personnel up here that have a wealth of knowledge. We'd love to help you out. If you haven't had a far out and waiting presentation in your community, I really encourage you to get a hold of Mary. She can help coordinate that for you. She's done a great job with these all over the state. And I think it's important for your communities to have these. Also, I strongly encourage you, if you have any desire, to get in touch with your local EMS crew and sign up to be a volunteer. A lot of us run on donations. If you can't donate your time, we would take some gas money. So it's an important service in our state. I encourage you to get involved and help out in your community if you can. Please come up and get some hands-on and ask any questions, and thanks for having us.